Talking. Okay, let's see here. The way it should be, I suppose. The gallery view. I'm not sure, babes. Well, Marty, you're the star of the show this evening here.
You said I couldn't say anything.
It's going to be hard for you. All right, I'll tell you what, we're just going to go right into our little presentation here. It's an overview about what microcurrent is. The first portion of it deals with the micromodes and the clinic in a case. So there are some things that the micromode can do. It's real microcurrent, okay? And we'll show you the difference. Is everyone able to see that, I hope? So basically, we're talking about microcurrent and our health. Here's some things. Did you know that your heart pumps nearly 2,000 gallons of blood each day? The kidneys each one have 1 million filters to purify the blood. Your heart has enough pressure to squirt blood for 30 feet. The nerve impulses to the brain travel at 170 miles an hour, and the brain uses as much power as a 10-watt light bulb. Now, here's the question that we're centering throughout the rest of this evening: is your body working the best it can? Your body can rebuild itself in 365 days, that's a year. Every 2 months, you can get DNA, your skin, in 1 month, the liver in 6 weeks, the stomach in 5 days. You get a new skeleton in 3 months. Your blood rebuilds itself in 4 months. Your brain rebuilds itself in a year. So the question again is your body working that way? So if the body can repair itself, why doesn't it? Are ear infections the result of an antibiotic shortage? Is low back pain the result of a muscle relaxer shortage? Are headaches the result of an aspirin shortage? And yet, you see, that's the way people treat these things. Almost everyone in the health field is treating symptoms. You first have to get sick, then you get treated, which for the most part simply treats the symptoms. And turning off the fire alarm does not put out the fire. So if you've been treating your body doing the same thing in the same way with the same results, and if you're not getting better, here's what one person thought about that. It's insanity. If you do the same thing over and over again and you expect different results, that does not make sense. And yet that's what almost everyone does. So the purpose of this meeting is to demonstrate the many methods which can be used with the clinic in a case and a clinic in a pocket. These are real microcurrent devices. Are there others out there? There are a couple that are real microcurrent devices. The rest are simply piggybacking on the name of microcurrent. Anyone can use the clinic in a case. As you can see, massage therapists, naturopaths, physical therapists, medical doctors, chiropractors, health spas use them. Home health care, many have the full case here. So the goal of this microcurrent system now is to help your body be the best it can be. Now we're calling it not an instrument, we're calling it a system. Help your body without more surgery. We're not against that if you need it. What about more prescriptions? When you go to the doctor, what do you expect to happen? you get a new prescription. Without more and more vitamins and herbs, without more and more visits to the doctors. There's a song, it's a number of decades old now, but it went like, the words were, money or love may make the world go around, but it's money that greases the wheel. And unfortunately, that's the way the system is. Let's talk for just a moment of what microcurrent is not. It is not a TENS unit. It's not a high volt unit, a low volt unit, Russian stim, not a beamer unit, not a foot massager, and it's not a so-called detox foot bath, which people are having this done, and they say, well, see, all the water changed color and it pulled all the toxins out of my body. That's very debatable. And interestingly, the water changes color whether you put your feet in it or not. So there's a lot of hype to a lot of instruments. The names that we have listed here are instruments that are used in the professional field, physical therapist and other pain control areas. You have to realize all electric treatments are not the best for good health. Microcurrent is like your body's own electrical system. So it's a good thing for people to be skeptical and ask, what is it supposed to do for a person? Well, there is a difference. There's ATP, cell membrane transport, protein synthesis. We didn't make this up. This is fact-based research, and that's what this shows. It shows a difference between 99 and 9/10 of all the instruments used in health clinics, hospitals, are on this side. They call them TENS, transcutaneous electrical neural stimulation. And it actually brings these healing factors down. Why did they use it? Because it deals with pain. Microcurrent, or MENS, microelectrical neural stimulation, brings all of the healing properties up. Let me illustrate that for you. There's a Greek word, and I separated it here, but the Greek word for energy means inward workingness. It's a matter of letting your body do the work. Most people block it with drugs or with other things. We talked about ATP. Microcurrent can increase the energy of each cell by as much as 500%. Now that's temporary, but it keeps working for about 40 to 46 hours after a single treatment. Now you think about that. What are you exposed to in 2 days' time? This is hard-nosed research. We have a plethora of papers we can show you. Isn't this what we want? We think about the bloom of a flower, that's energy. The increase of fruit is energy. The growth and repair of the body is energy. Those three statements were made 102 years ago publicly, and it's still true today. Everything is energy. Microcurrent can increase the absorptions of vitamins in your body, whether you take pills, herbs, or whatever. And of course, Hippocrates said, let food be your medicine, and medicine be your food. Now, the problem is absorption of the vitamins. Some of the medical doctors say you eliminate 90% or more of all the vitamins that you take in the urine and in the feces, that it passes through the digestive tract. And it goes into the real problem of malabsorption, which means it simply passes through. Again, you can almost steer the effects of the healing powers of microcurrent to where you want on the body. If you take a vitamin, for example, for your liver, you can treat your liver. Now you've increased the absorption factor in that specific area of the body by 30 to 40% by this herb or this vitamin, whatever you're taking, by 30 to 40%. That should give us food for thought. Again, we're talking about why use microcurrent. Again, we have a lot of research here on it speeding healing in your body by as much as 73%. The Canadian Olympic team was using microcurrent, and they found that when they had a non-union fracture, now a non-union fracture, if you don't know what that is, it's you have broken your arm or your leg so badly the bones are not even touching. And they've taken 2/3 of the healing time off of that by using microcurrent. Now, that's very outstanding, I think, and I've seen it happen. Something else that is attacking most people is the problem of blood sugar. And so they go to a doctor and they get their blood sugar checked, or they do it at home. Microcurrent can stimulate insulin binding in your body. And many doctors will tell you that yes, you can control your blood sugar by what you eat, but people don't do it. They want to eat what they want to eat because it tastes good. Nevertheless, you can stimulate the area of the pancreas and the liver, and you'll see an illustration of that later on. But this is what we want. Just remember, everything is energy, but it does not have to be high energy. These are actual photographs of a photograph. I saw the originals, and it was a thermograph picture of a person's back. This was a engineer on a train. They ran from New York to Florida, down to South Miami. And a locomotive jumped the track and turned over. I saw this engineer, and his back had been inflamed for almost a year. We did a 45-minute back treatment with the microcurrent, and this is the way it came up. We didn't call it the clinic in a case back then. That was one of the earlier models. In fact, the first model in the United States by Dr. Thomas Wing, who really pioneered all of this. So microcurrent seems to have the unlimited ability to help with almost any health problem. So if you're dealing with pain and say, yeah, I put it on my foot or put it on my leg or on my back or on my shoulder or on my neck, and yeah, it helped for a while, but it came back. Well, isn't that what happens with prescription pain medicine, your Tylenol, your Advil, and so on, and with a TENS unit? So the idea about this is you're way beyond pain control here because you are normalizing the body. You're dealing with all parts of the body. And that's almost another seminar in itself, showing what it does. So how can it help people? Yes, we deal with pain, but we have an immediate increase of energy that we call the core energy. Now, you may not feel energized. It's not that kind of an energy boost. This is a normalizing by letting your body do the best it can be. Cell renewal. We have slides on that from King's Medical University in London, England, showing how it really does proliferate tissue repair on a cellular level. Body detox, membrane transport, that's getting your nutrition through the cell wall to where it'll do what it's supposed to. Many people are using it for facelifts, body lifts. Uh, they lift the gluteus max, which is the posterior aspect of the anatomical frame on your body. And you can do a breast lift in just about 10 minutes. And we actually demonstrated that in Orlando. No one wanted to volunteer, so a man did, and we lifted his breast a little over an inch. Then we had to do the other side. Is it temporary? Hey, everything's temporary. The point is you boosted the body in that regard. As far as the immune system is concerned, here again, we have all kinds of research. And what's the problem today? Why is it that some people can be in a crowd of people like we've seen on television recently, and so many people get the COVID-19, the rest don't? Why? Maybe they were sneezed on or close to the same person. It was because their immune system kicked it off. Someone asked about chelation therapy, which is something to take heavy metals out of your system, but it also will clear your veins and arteries to where you don't have a stroke because of them being clogged. Well, you can do that. It supports the vascular system. So as we mentioned, the clinic in the case has been called a complete health care system. So if you hurt, if you have other problems, and again, we're not dealing just with pain, then you need to treat with the right instrument and the right method. We're talking about the clinic in the case and the clinic in the pocket. Again, what you see demonstrated here on your right, the clinic in the pocket can do the other things. It takes the clinic in the case. And we look for results in minutes and even seconds. We did a seminar in Holland, and this one gentleman, very good friend of mine, he had over 100 people in a schoolroom. And so we challenged the audience. We said, we're going to take 20 people with any kind of pain that they have, and we're going to give you a 1-minute treatment. Come up here on stage. And we got results on 20 people in 20 minutes. I can do that almost anywhere. I've done it many times since. And you know how hard it is? You can almost train a chimpanzee to do it if you have the right tools. So you get results very quickly and they last. But for those of you who have the instruments, the clinic in a pocket or clinic in a case, you need to use the right tool. You need to think, what do I want to do? What do I want to treat? Don't just slap on pads or put your feet on pads. Ask yourself these questions. What am I trying to do? What is part of my body am I trying to improve or change? Well, here's some of the tools that we're going to look at. Now, all of these are hooked up to the brains of the clinic in a case. We're going to look at the pads first. And let's see how these can be used. Some of them are pre-gelled pads. Some have called it sticky pads. And others are carbon electrode to where you either need a little cotton pad or a little moisture on them. Why would we use them? For longer, non-attended treatment. There are occasions when you need to give a long-term treatment. So you just put them where you hurt. Here you see the shoulder, another in the bicep, tricep area. That's for chronic pain because in that instance, you will have to give multiple treatments. But the nice thing is instead of wearing off, it wears in. And again, other seminars that we have show research on that. Just think about, where do I hurt? So you can just simply put those pads wherever you hurt. One of the things, if you're not doing this with either the clinic in a case or pocket, is electromassage. And one of the pads, the sticky pads, is on the hand of the person doing the rubbing, whether you're a massage therapist or husband or wife or friend, whatever. One pad is on your hand, it's going to be rubbing the painful area, and the other pad are down here on the person that you're treating. Fantastic. At the Olympics, this has been used for about 25, 30 years. This is one of the most effective things to get the people back into the race. If you haven't done it, please do it. It works, either instrument. If you've ever had a foot treatment, foot reflexology with the clinic in the case, this is fantastic. These are some people right there in Daytona a few years ago. Foot treatments are very, very nice. They have a curative effect to a point. But if you do this, and if you notice here, we have the same hookup. The patient, in this case, it's the husband, has a pad on the back of his hand, and his wife is rubbing his feet. So that means the current goes all the way up into their body. You talk about a deep treatment, that's it. Sometimes people will say, well, I go to a doctor or an acupuncturist or someone, they use a laser and it goes so many millimeters under my skin. This goes through your whole body with these healing factors. Again, you can rub the neck. It's a very simple thing. If you have not done this, you're missing out. Really. If you're married, you don't have to go to a massage therapist or someone to do that. If you're a friend, you can do that. Oops, here's some folks up near Columbia, and they're not even using any wires. You notice she is holding her hand on the command center here. He has his hand on the other side, and she is giving him a neck massage. If you listen carefully, I think you can almost hear him say, ah. Here's somebody that we know and treating a friend with electromassage. So that's the question, friends. If you have an instrument, have you used the treatment pads in these ways? Please, the next time we talk, if we talk in the next week or so, we may ask the question, have you done electromassage? Have you gotten that kind of a treatment? So that's the way you can use these pads. But what about the Q-tip probes? Can you treat the bones and joints, the muscles, the organs? You can treat all parts of the body with the Q-tip probes. Why are they so effective? Because the effect reaches very, very deep into the body systems. Why do we need to do that? Because everything needs to be in balance. Some use this to improve their eyesight or to prevent any more deterioration. All of these factors are involved. And the point, if you want key words, is accelerating the rejuvenation process. On the other hand, if you have something missing, if you've got aluminum knees that may have been taken out of an old Toyota, no, we're kidding on that one, but if you have knee replacement, hip replacement, obviously you do not have your original equipment, but you can still be the best you can be. And others have asked, well, hey, I've got these metal parts, will this affect it? The answer is no. But let me give you a word of caution when you go to a health provider. If they use an ultrasound on your metal knees or hips, or some have had a head injury, they've had metal plates in their head, It can literally cook the flesh. That's
Mm.
not this. This is an ultrasound. So be sure if you go to some health provider who wants to treat you for pain on your knees or wherever you've had something replaced, please tell them I have metal. I don't want that. With microcurrent, there is no problem. So there's levels of organization, the cell, the tissue, there's organs, the entire system that will help the organism that we call the body. Again, you may not be perfect. We're going to have to wait a long time for that. Maybe even maybe even 1,000 years. That was in a book somewhere, wasn't it? um, but we can be the best we can be without more drugs, without more surgery. Here's why it's necessary to go deep. We go into what's called the myofascial area of the body. If you've ever seen a chicken breast and not all hacked and cut up, there's a very, very thin membrane on it. And that kind of holds everything together. But you also have different layers on every muscle of the body. How would you get into that? How could you be specific? Remember, we said the probes can be very, very direct. The Q-tip probe can hit acupuncture points that you're not even aiming for, and it can go deep into the muscle tissues of the body. It has a whirlwind penetration effect of both the frequency, waveform, power, or current. Again, this is without any, or with either of the instruments that you have, the clinic in a case or pocket, because it comes with probes. Okay, lady, you have a legitimate question. How? Well, if you notice this, one probe is stationary. It's been established that, hey, I hurt right here. So poke around on a person's back or wherever they hurt and say, where does it hurt the most? You put one probe right on that area of pain. And Dave, I think you have these probes. These are the smaller ones. And so you put the other one at the 12 o'clock position. You hold it for about 5 or 10 seconds. You go to the 2 o'clock position, the 4 o'clock, 6 o'clock, 8, 10. And when you go around, you reevaluate. You can do this in 30 seconds or spend a minute on that. You are going to get immediate relief. And it's not going to totally wear off. Well, why doesn't it fix the whole area? Because this area is connected here. I think this looks like the mid-trapezius. It also intersects with the neck muscles, the upper traps, the lower traps. You have other internal organs and muscles. So the point being, this is the most painful ouch points. You can make a difference in a minute, literally. Another way is to go through the muscles of the back, of the neck. As you can see down here, this is not a bandit machine. It's listed with the FDA. This is an old gentleman from South Florida, and his wife said, my back hurts. Well, these happen to be the most powerful points in acupuncture using only 2 needles. It's called bladder 54, or more popularly called bladder 40. Why do they call it bladder 40 in acupuncture? Because it connects with, guess what? The bladder. But it's the most powerful points in acupuncture. He's not using any needles. He's using the Q-tip probes. And she got relief immediately. You can treat the knees with the double Q-tip probes. Now you can put the pads on there too. That's what most people do because they don't take the time or give the effort to treat themselves using these other tools. These are worth their weight in gold because of the quickness and the depth of the treatments and the effectiveness that is given. The nice thing about them is you can treat through clothes. Isn't that interesting? With either instrument. So if you wet the Q-tips and find the ouch point, you do the circling technique around it for just a minute, then reevaluate. Can you go around in a bigger circle? Absolutely. Can you treat other areas? Yes. So it's a very, very versatile technique. We've actually, in times past, when I was involved in marketing this, which by the way, I don't sell them, that's not the reason for this. These are available. Dr. Epitropoulos uses it extensively in his office, and he can also see about getting an instrument if you do not have one. I can talk to you about other sources as well. Um, if you don't have an instrument, say you'd like a demonstration of this, and you're going to find he's using that on you. You can treat specific spinal problems with these. I took this photo. I was working for a week in Bregenz, Austria. And so the therapist, we were teaching her how to do lumbar areas. Here's another way that you can use it. And this is all in your treatment manual. Okay. Hip and sciatic pain. Now, you saw in the earlier portion of our presentation where you can put the pads, right? But let's say you don't have time for that. You have something to do. Here you're treating through clothes as long as you keep the Q-tip moist. Go to the ouch point, okay, which is going to be somewhere on your gluteus max or on the lateral side of your body. Put one probe there, go up into the area just below, excuse me, to the side of the spine, and you're using your other probe, and you're only treating it for like 10 seconds, moving it right along the side of the spine, and that's it. Same is true with shoulder pain. You can put the pads on there and you will get results. But if you follow through or do this even before the pads, again, a stationary probe, putting it along the collarbone. We did a demonstration, Michael, you remember this, in Gold's Gym in Ormond Beach, Florida. And the owner had a shoulder problem. He said he had it for 3 months. And he said in 1 minute, he says, he took this away by using this technique. And he says that was a month ago and it hasn't come back. That doesn't mean that every time it won't come back. It depends what else is feeding the problem. So the point being, friends, if you have those Q-tip probes, please use them. The clinic in the case has the cluster module. This will allow you to treat larger areas of pain, blockages, restore balance. Again, the question is, how do you treat from it? Well, there's 21 different ways you can place it. You put it on the TMJ, carpal tunnel syndrome, arm, wrist, hands, eyes, cellulite. Nobody has that that's on this program, do they? Hips, sciatica. Some have put it in their pocket while driving. Now, you have to have it hooked up, of course. Others, you can use it on the upper back, lower back, area of tension, shoulders, abdominal pain. It works great for gallbladder pain. So if you can't eat nuts and you have pain, simply hold this over your gallbladder. You can turn the power down way low and leave it there until the pain goes away. Because what happens there with the gallbladder is you have a spasm in the common bile duct. And that will break that spasm. It'll take away that irritation and inflammation. You could put a pad over it too, but this makes it so handy, and you can treat through clothes. Many, in the years of testing that I have done, much back pain is caused from the colon, the uterus, the ovary, the prostate, and the testes. You can put this over the uterus, through clothes or on top of the skin, either way, and you'll see if your back pain is less. Chelation. This is very, very effective, um, and it helps to open up the veins and the arteries to blood flow. It'll also can be used in scar reduction. So if you've had a hysterectomy or some type of operational scar that's rather large, then you don't want to treat just the scar. You want to treat on each side of it. This will sandwich it in between. And you can use the probes, of course, too. This is demonstrating for a gallbladder problem on the skin or through the clothes. Keep the Q-tips wet. A lot of problems are caused by a temporal mandibular joint called TMJ. If you have your molars, 1, 2, 3, or 4 molars, the very back teeth removed, your jaw is going to be off kilter. And chiropractors, medical doctors will tell you that a lot of back problems, headaches, neck pain is caused by the strongest muscle in the body, which is called the masseter. And it goes from your ear down to your jaws. It's probably about 2.5, 3 inches long. And you can quickly treat that, a minute on each side of the body, and you immediately release the spasm. You immediately release the pressure on the nerve that goes down through that I think it's 2 millimeter opening in the jaw. Here we have someone sitting with the upper back problem, and she has the cluster module, and the Q-tips are wet, and so she's treating through the clothes. The point being, have you used the cluster modules? If you have them, they're fantastic. And speaking of fantastic, here we have the BMWs, the Body Magic Wonder Wands. And as people are wondering, how do you use it? Well, here a husband is treating his wife with these, and you get immediate results. You don't have to wait. Ask the person to turn their head left and right, and give them a minute or two treatment, and then ask them to turn it left and right again, and every time there will be a difference. A 30-second treatment, and if you haven't done this, if you have the clinic in the case, you put the cluster modules right on the edge there of the upper trapezius, right there. You press down and ask them to shrug their shoulders and hold it. You hold it there for 30 seconds. You get an immediate release. Immediate. Again, do that. Turn your head to left and right, little test, and they will say, wow, what did you do? And it'll happen to anybody. Now, there's other things that need to be treated there and other techniques, but all of that is in your treatment manual, a step-by-step, 1, 2, 3, 4, 5 type of steps to do that. You can use them on the back, as you can see here, and basically you get in the middle of the muscle. Here you see the gluteus muscle, your butt muscle. And what he's done is he's put these very close together, and he's spreading this one that way, and this one this way. And that stretches the muscle, and you only have to do it 2, 3 times, and there's an immediate difference. But it won't happen unless you use it. And that's why we're taking the time to show you, use these tools. Here's someone treating a tennis elbow with the BMWs. That was in the office when I had a clinic. This gives an immediate result to a hiatal hernia. A lot of people with acid reflux, It's because the esophageal termination point or junction point into the stomach area is protruded through the diaphragm. And you simply put it under the sternum or your breastbone, push in and push down 2 or 3 times. And if that's a problem, if you have indigestion, if it is a hiatal hernia, even if it's not a hiatal hernia, but if it is, sometimes after you do this 2 or 3 times, you'll hear the stomach go. And what that's doing is it's releasing that esophagus going through the stomach. This was taken in Orlando. Medical doctor had one of his assistants doing a facial toning technique, and we were greatly involved in the facial toning business for a long, long time. We got involved with it in 1979. It too makes a difference immediately. It's not come and have 10 treatments and now you'll see a difference. You see a difference right away. How much? It depends on who you are, how long you look the way you are. Will it last? Nothing lasts forever. So it's a protocol of 10 to 15 treatments. And I'm laughing because I got some memories going back there of people. Some have responded fantastically and others minimally. Again, it's what are you starting to work with? That's another seminar. So here's a question. Would this help this? Now, you can't see this, and we don't have a picture of it, but this, on the other side of the command center, is a huge cluster module. So basically, you now have Q-tips and treatment devices on the opposite side of what you're seeing. And it can treat all of that area. And here you see someone who has had colon cancer, stage 3, and that's the way he treated. We have information on that too, but you can see holding it over that area, it hits the pancreas, it hits the liver, which is this huge area through here, and if you move it down a little bit, you're getting it in into your intestinal area, and onto the side, you've got the ovaries, and then the uterus and the bladder and so on. So you can use this, no wires, just moist Q-tips on the other side if you have the clinic in a case. This is a very powerful treatment. And it helps detox the body, it improves circulation, helps balance all the body system. If you have an instrument, you have what's called carbon electrodes. These look like rubber pads. She has one in the thoracic outlet. That's the area between the neck and the shoulder. A very powerful area there to help milk the lymphatic system. It goes all the way down the body. The other pad is on the bottom of the foot. Very, very important to drink a glass of water before and after the treatment on any time you use microcurrent, because it does produce a detoxification of the body. And if you treat yourself heavily and do not drink, you will know it either later that day or probably the next day, because you'll be fatigued. Your body is dumping stuff that you don't want in you, and you did not give it the fluid to lubricate the bowels or to urinate the detox effects. The nice thing is this is an easy way to balance all body systems. And here's someone who's using both of them. The command center treats from hand to hand. The foot treatments treat from leg to leg, but they also go all the way up through the body. This is a very, very powerful treatment. especially with the clinic in a case, because it has specific healing frequencies that are pre-programmed, and they deal with a lot of things. I think that's what we covered, Michael, last week on some of these frequencies. Here you see a couple people treating themselves. He has his feet on the pads. She has the command center. Two people treating themselves at the same time. The feet are on the pads, and he's holding each handle. He's not as grumpy as he looks. John. Okay, so everybody asks, well, how often should you treat yourself? Well, after seeing what you've seen, it boosts the immune system. We're not just dealing with pain, we're balancing the body, we're energizing it. How often should you treat yourself? Well, how often do you treat open doors? Pick up pencils, armchair rests, telephones, others coughing, go to the toilet, packages come in, letters. At home, you've got the same thing. All of these things. So what are your dogs and cats bringing in? Well, maybe they're an inside animal, but they still have inside things in their bodies. All of these things would give an occasion to treat yourself. If you go out somewhere, give yourself a treatment for 5 minutes. When you come home, give yourself another treatment for 5 or 10 minutes. This is kind of an overview of the 3 programs with many, many frequencies. First program is balancing the body. We call it body balance, and it deals with pain, scars on the body, tendons, muscles, edema. If you ever have any swelling, body balance is what you want to use. Stress, it has anti-stress frequencies, promotes healings and wounds. The second one, energizing for wellness, deals with sarcoma. That's not a nice word, is it? Different kinds of virus. Malignancy, that's not a nice word. And bacteria. So you get virus frequencies, malignancy frequencies, and PCA. All right, I know you're asking a question. What's PCA? It's a precancerous frequency that a number of researchers seem to have come to a conclusion that if you use that frequency, it seems to help a lot of people who are on the edge of having a carcinogenic event. Auto sweep is like a body scan, sweeping thousands of healthy treatment frequencies. The nice thing is it's a lymphatic flush in just minutes. So again, how can you use this? Lymphatic drainage, hand to hand, foot to foot, treating with the pads, treating with the probes, very, very effective, treating with the BMWs, and treating with the cluster modules. All of these are available with the clinic in the case. So we've had doctors evaluate this. They've agreed almost anyone could benefit. It's very easy to use, just 1 or 2 clicks, and it starts the treatment. The nice thing is it's a very safe form of treatment. The FDA have said this is a non-significant risk device. So the point being, thank you very much. You have the most effective healthcare instrument in the world. Please, please, don't get stuck doing the same thing over and over again. Look at the versatility that you have with the clinic in the pocket, the tremendous application of almost anything you run into health-wise with the clinic in the case, with frequencies that are have been heavily researched. Please, friends, use them. And we look forward to your next time that we are doing a seminar.
So I have, John, this was fantastic, tremendous, tremendous. I've unmuted everyone, or if microphones are still muted, go ahead and unmute everyone. John, it was just, each time I listened to you, and I've been listening to you now for a long, long time, and each time I listen to you, I hear something new. And that's why you can never hear enough of John's presentations, because you always will glean something from each presentation that is amazing information. So I'm going to open up the mics here. So folks, if you have any questions of John, before you ask him any questions, I want to remind you what I'll do for next week. We're just going to stay with the Zoom format. As I was listening to you, John, I think it's best that we just stay with the Zoom format for everyone instead of worrying about live streams. So what I'll do, John, is if you wouldn't mind, when I send you an email for the invite, if you could share that with everyone, because I know you have access to, obviously, to their emails. So I'll let you do that for me if you don't mind. And
Okay, sure.
But please, folks, if you have any questions, don't hesitate to ask John. So the floor is open. Anything at all.
I have a question.
Terry.
How do you know which level of power to set it on? 1 to 10 generally is what's on there. I don't have my manual anymore.
Oh. Well, you need a manual because that goes through everything we've looked at here. We can talk about that afterwards and see about getting you one.
Okay.
I wanted to ask a question.
Holly.
Yeah, in view of pandemic and cases going up, should we happen to know somebody, or if we ourselves actually have the virus and it's in a later stage before the cytokine storm starts, or around the time that the cytokine storm starts, what frequencies or applications would be best to try to deter the cytokine storm?
Well, you know what? There's no one size fits all, but there are some protocols that I can relate to you that others have used. At one of the seminars that Dr. Mike and I have done, I asked someone, how often do you treat yourself? And they said, every day. I said, wait a minute, every day? And they said, yes. I said, what do you use? Oh, I use all 3 programs. Really, every day. They said, well, usually it's not unusual to miss on a week, one day on a weekend. I said, how long have you been doing that? They said, well, since I got the instrument. I said, how long since you've had it? They said, 3 years. Wow. On the other hand, you have other people who will treat themselves once or twice a week just as maintenance, which is greatly recommended. Anytime you go out is a good time to treat yourself before, to bring up your immune system, and then come back and treat yourself again. On which program, on which power, you've got a lot of information in